disease activity, get those inflammation marker back to normal, and telehealth mindfulness recovery effective than usual care in individuals with opioid use disorder and pain. The US is experiencing an opioid crisis with an estimated 10.1 million individuals who misuse opioids or have an opioid use disorder or OUD. To address the crisis, programs that provide medication for opioid use disorder are expanding. MOUD is the criterion standard intervention for OUD, and MT is the oldest and the most widely used MOUD, yet half of people who begin MT discontinue treatment within a year, and within 6 months half of people retained in an MT program continue or return to use of opioids and other illicit drugs. New interventions are needed to improve MT outcomes, and retention methadone treatment fails to address the emotion, dysregulation, pain, and reward processing deficits that often drive opioid use disorder. Even small amounts of physical activity could be valuable in late-stage lung cancer. New research has found less than 5 minutes of daily physical activity could be linked with prolonged life in people living with inoperable forms of lung cancer. Lung cancer kills more people globally each year than any other type of cancer. However, new Curtin University-led research has found less than 5 minutes of daily physical activity could be linked with prolonged life in people living with inoperable forms of the disease. The team from Curtin School of Allied Health, Curtin Enable Institute, and other research organizations measured the daily activity of 89 people living with inoperable lung cancer from the time of their diagnosis. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. Brain implants effective in restoring cognitive abilities after traumatic brain injury. Brain injuries are devastating and often affect quality of life. More than 5 million Americans live with the lasting effects of moderate to severe traumatic brain injury, difficulty focusing, remembering, and making decisions. Though many recover enough to live independently, their impairments prevent them from returning to school or work and from resuming their social lives. The clinical trial is the first to target this region of the brain in patients with moderate to severe traumatic brain injury, and it offers hope for many who have plateaued in their recovery. In 2001, Gina Arata was in her final semester of college planning to apply to law school when she suffered a traumatic brain injury in a car accident. The injury so compromised her ability to focus, she struggled in a job sorting mail. Her parents learned about research being conducted at Stanford Medicine and reached out. Arata was accepted as a participant. In 2018, physicians surgically implanted a device deep inside her brain, then carefully calibrated the device electrical activity to stimulate the networks the injury had subdued. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.